Welcome to Penrose Learning, where we make understanding easy.
You start by preparing the environment and the patient. This reduces variability. Sit quietly for 5 minutes with feet flat and back supported, and make sure the arm is bare and at heart level. Select a cuff sized to the arm circumference, 2 small overestimates, 2 large underestimates. Once the cuff is known, wrap it snugly with the lower edge 2-3 cm above the antecubital fold. Check the gauge and stethoscope placement before proceeding to inflation. You now perform the measurement step by step so the reading is accurate. First, palpate the radial pulse and inflate quickly until the pulse disappears, then add 20-30 mmHg. This prevents missing systolic. Deflate the cuff slowly at about 2-3 mmHg per second while listening with the stethoscope over the brachial artery. Note the first choric cough, sound as systolic, and the point where sounds disappear as diastolic. Repeat after 1-2 minutes to confirm. You finish by ensuring the measurement is reliable and by addressing common issues. Take 2 readings 1 to 2 minutes apart and average them. If they differ by more than 5 mmHg, measure the other arm and use the higher consistent value. Make sure the cuff size and arm position were correct. Incorrect cuff or arm below heart level are the most frequent errors. If the patient is anxious or talking, pause and repeat after a quiet rest to get a valid result.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.